Welcome back to Wet Digits. Hi everyone, today I'm presenting you with a very common tick-borne disease named as bovine theileriosis in ruminants. Etiology and vector. The tick is Hyaloma anatolicum and the species of Theileria are Theileria annulata cause tropical theileriosis and Theileria parva cause East Coast fever. Now how this disease spreads. Firstly, the infected tick with sporozoites bite the healthy animal and the sporozoites enter into the lymphocytes of the healthy animal to form macrocysons. These macrocysons divide rapidly to form merozoites and merozoites proliferate so fast in the lymphocytes that these rupture the lymphocytes, released into the bloodstream and entered into the RBCs. In RBCs, these are known as pyroplasms. Severe hemolysis and destruction of RBCs leads to hemolytic anemia and icteric mucous membrane. Now, these pyroplasms within the RBCs are ingested by the tick, and in the gut of the tick, gametogony and syngamy occurs, where male and female gametes fuse to form zygote or ookinete, and this ookinete migrates to the salivary gland of the tick. In the salivary gland of the tick, sporogony occurs to form different sporozoites, and the cycle continues. Now, what are the main clinical signs associated with bovine theileriosis? Firstly, very high fever from 105 to 107 degree Fahrenheit, severe anorexia and depression, emaciated animal along with lymphadenopathy, that is very swollen prescapulaar and prefemoral lymph nodes. Diarrhea and dysentery may be present. Respiratory distress and pulmonary edema can be there. Lacrimation and petechia around the conjunctiva can be seen. Now let's come to a case history. A 5-year-old buffalo presented to the clinics with a history of very high temperature ranging from 106 degree Fahrenheit to 104 degree Fahrenheit. The clinical status of the buffalo shows temperature of 104 degree Fahrenheit, anorexia from last 15 days, rumination was absent for last 15 days, and mucous membrane are pale to white. Animal was cachectic, and on clinical examination, you can see the mucous membrane. Also, the vaginal mucous membrane is pale. And on blood examination, complete blood cell count, hemoglobin is severely low, that is 3.7 gram per deciliter, shows the condition of the animal. Packed cell volume reduced to 13%. Total erythrocyte count reduced to 1 lakh. And on blood smear examination from the peripheral air vein, we found characteristic pyroplasms diagnostic of theileria in the RBCs. And on lymph node aspiration biopsy, we found coach blue bodies, that is macrocysons inside the lymphocytes. Emergency blood transfusion was done and 4 liters of blood was transfused to the animal. Complementary treatment were advised, that is drug of choice buparvacone at the rate 2.5 mg per kg DPIM to be repeated after 48 hours. Oxytetracycline LA 30 ml DPIM. Liquid isocure for gut health at the rate 300 ml per os once a day for 3 days. Liquid charcoferol and 3D RBC wet, each 50-50 ml per os twice a day for 5 days for blood volume maintaining. And injection tribuvate at the rate 12 ml intramuscularly once a day for 5 days. In the follow-up, the animal has started eating within 2 days of the treatment and gradually improvement in the condition of the animal has seen. Owner were advised to maintain tick control program, and also when the animal had presented to the clinics, there is no tick present on the body of the animal. Now here's a question for you. Why oxytetracycline was added along with specific treatment of buparvaquinone? Think and answer. Thank you so much for your time and listening.